we all recognize that the last 24 hours have been historic and disgusting in most regards. When you look at what happened yesterday in Washington, D.C., an insurrection that is led by the President of the United States is something that as Americans, we all should be deploring. And I'm pleased to hear people are talking out. I'm also concerned, I think as many are, of the security at the Capitol. To see the United States Capitol so easily breached is a matter of grave concern, not just domestically, but I'm sure that there are other nations around the country, around the world, that are not friendly to the United States who look at that and are asking themselves just how easy it is to breach the United States Capitol. So there's a lot of work that needs to be done. Again, for those members of Congress, both in the House and the Senate, that stood up to this insurrection, I thank them. To those officers that tried to maintain the peace, I thank them. A lot of people stepped forward, but again, you had a situation that was essentially unprecedented in our American history. And it's a day that hopefully we'll never see again, never see anything like that again. Particularly at a time when we are trying to deal with a very, very serious pandemic here locally and throughout the country. And so that's where our focus should be, not on creating an insurrection and trying to delay the peaceful transfer of power in our democracy, which is, again, clearly what we saw happen yesterday. But here locally, we continue to do the very, very important work, both in terms of testing. We're beginning to ramp up our vaccination. I'll talk about that in a minute. But the testing component remains a very, very vital component of what we're trying to do. And I want to thank all of our employees at the health department and all those that are working with them to continue this work. As the weather gets colder, although we've been pretty lucky here in January so far, this gets to be more challenging. But we've got a lot of people who are really stepping forward to do this work. And just yesterday at what we now call the New American Family Field, we had 916 people who were tested. On the Northwest side, we had 423 people tested. On the South side, we had 204 people. And in the South Milwaukee zone, we had 247. So again, we had well over 1,600 people who were tested yesterday. We'd like to see those numbers even higher. Dr. Weston, I'm sure, will be discussing the positivity rate, which is a concern as we see that creep a little bit higher, because that is the number that is really relevant when we are trying to determine how good a job we're doing in controlling the spread of this disease. But our key indicators for this week are red for cases and testing. They're yellow for care and PPE and tracing. So we clearly want to make more progress in the area of cases and testing. But most recently, our cases indicator was green, which tells us that we are trending poorly. We were anticipating an increase in positive cases following the holiday season. And unfortunately, the data is showing this to be true. We're now at an average of 11% positive. And I know that wintertime makes physical distancing more difficult. We spend a lot more of our time indoors, which we know increases the risk of spreading the virus. But we have the power to continue to drive down our percent positive rate and keep our families and loved ones safe. So the solution remains the same as it has been for the last almost 10 months now, and that's to watch your distance, to wash your hands, and to wear a mask. So we ask people to please continue to do this. I'm very, very pleased that yesterday we were able to get an allocation of 100 doses of the Pfizer vaccination here in the city of Milwaukee. I spoke to the health commissioner. Well more than half of those have already been distributed starting this morning. So that is moving very, very smoothly. There have been no negative reactions at this point. And this is going to the frontline workers that we have who fall into the 1A category. So it is going to be the people at our 3 healthcare clinics. It is going to be people who are at American Family Field, both those who are doing the actual testing and the volunteers who are assisting them. And it's going to be 50 of our firefighters. But again, I'm very, very pleased. And what this is all doing is setting up for a much more expansive increase that we'll have as we get the next dosage of Pfizer vaccinations, which we know will be 800, at least 800 for next week. And we'll get the first allocation of those on Monday. We're pleased that we're able to work out this great arrangement with the state of Wisconsin, and they have been just wonderful to work with. As you all know, the Pfizer vaccination is the one that requires the deep freeze. And if you don't have the deep freeze, it has to be used within 120 hours. We have structured the allocation of that and the distribution of that so that we don't run up against that 120-hour limit And we have enough people in our 1A category that we're going to continue to work on that. We're eager, of course, I think, as is everyone, to get through this 1A category and then to get to 1B, which includes essential workers, includes teachers, includes our police officers. But we still have to get through the bulk of the 1A before we move to that. So every indication is that we can ramp up and be prepared when we go to the broadest distribution of the vaccine. And that's what our goal is to build this distribution network as quickly as we can. I also recognize that there are a lot of questions. There are still many, many unknowns about the vaccine. There's unknowns that we have about distribution, and this is all happening in real time. But people have lots of questions, and we would like to do our best to answer them. So as we've done in the past, if you have questions you would like us to answer at our future press briefings, please leave your questions or comments on my social media channels at Mayor Barrett on Facebook or at Mayor of MKE on Twitter. Those are the best ways for us to get this information and then to get back to you and use them most likely in these press briefings as well. So with that, I'm going to turn it over to the county executive and thank him for the great work that he's doing and that the county is doing in this partnership that we have together. County executive.
Absolutely. Thank you so much, Mayor Barrett. And, you know, it's kind of hard to start today without acknowledging what many of us, if not all of us, witnessed at our nation's capital, which was an insurrection. And like I said in my press release, it was a sad, dark day for our country when we have more than 100 House members, a dozen senators, and the President of the United States incite domestic terrorism and attempt to delay or disrupt the peaceful transfer of power of the presidency. Yesterday's events were extremely humiliating, and it was a humiliating day for this whole country, an attack on our American democracy, and it was a distraction from the real work that needs to be done on behalf of the American people. And I would like to thank the many people who dedicated their lives to serving the public and working tirelessly to ensure a healthy, safe, and prosperous year ahead. This work is difficult, it's time-consuming, and sometimes burdensome. And our public servants do this willingly and selflessly for the benefit of our community. So we need to remember that. And so today I want to encourage us to follow their example and stay focused on caring for our community between ensuring peaceful transfer of power, vaccinating the American people against COVID-19, and helping residents navigate the many negative impacts of this pandemic. There's real important work that needs to be done. And I want to welcome our guest today, Dr. Mary Beth Graham from the Medical College of Wisconsin. She specializes in infectious disease and is joining to discuss the safety and efficacy of the COVID-19 vaccine. And we continue to turn to experts like Dr. Graham, Dr. Weston, and our healthcare professionals, and the 11 public health officers representing the municipalities throughout Milwaukee County as trusted sources of information. So let's keep our focus on the path forward and continue to make healthy choices for the benefit of ourselves and our community. And so with that, I just want to say thank you for all. And I know we witnessed a lot of stuff last night, and hand it over to Dr. Weston.
Thank you, Mr. County Executive. Good afternoon. First to our numbers, we have had 87,442 confirmed cases of COVID-19 in our community and 903 individuals who've died in Milwaukee County. We have recognized and we've saluted our first responders many times during this pandemic for their courage, their selflessness, and their perseverance in showing up day in and day out to care for and protect those most in need. Yesterday's terrible, reprehensible events in the Capitol remind us that regardless of COVID, our law enforcement, our fire, and our EMS personnel are called on often, sometimes without even moments' notice, to respond to unpredictable, uncontrolled, and dangerous situations. We're appreciative of the work that they did yesterday and the work that those in our community do every day. And on that note, I'm encouraged to report that yesterday the Milwaukee County Office of Emergency Management vaccinated an additional 80 EMS providers. And we continue to work with the health systems and our local health departments to vaccinate every one of our EMS providers as fast as possible as we work so hard to protect those who work to protect us. As far as our trends, we continue to see increases in our percent positivity, as well as low levels of testing. This is a dangerous combination and a warning sign of what could come. These two trends have led to our key indicators turning red